Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is March 26th, 2021. As always, we start with the COVID-19 statistics. Worldwide, we have over 126 million cases and nearly 2.8 million deaths. In the United States, we have over 30.5 million cases and over 560,000 deaths. Case and death numbers are both definitely decreasing or slowing down. It's so much better than it was even just a few weeks ago. That being said, in the United States, we're still at about, on average, 60,000 cases and over 1,000 deaths per day. That's still way too much, especially those death numbers. We really need to get those down. So please, we need to follow those CDC guidelines. The vaccines are definitely helping. But the rollout is great. It's getting better, but until it's fully rolled out, we need to continue using the CDC guidelines. So please continue wearing a mask, avoiding large crowds, washing your hands, and practicing social distancing. We'll start off today with what is probably the biggest question about the vaccine at this point. Does it actually keep you from, does it only keep you from getting sick? Or does it also keep you from getting and transmitting the virus? Scientists assume that it probably does, stop the transmission and everything also, because that's what most vaccines do. But the honest answer right now is we just don't know. Because COVID-19 has been so weird in so many different ways, we just don't want to assume anything. So Dr. Fauci announced this week that a new study is being started that will determine the answer to this question. So 12,000 college students have volunteered. They'll be split into groups. Some will get the vaccine, some will get a placebo, so they won't know who actually got the vaccine and who didn't. But they will have daily tests done to see if they are test positive for COVID-19. They will also keep track of where they go and who they come into contact with. So this will be a very thorough study, and it'll likely be at least 5 months, they say, until we get results. In the meantime, preliminary studies do show that the vaccine should be able to confer immunity for at least 6 months, possibly and likely much, much longer, possibly 2 or 3 years or even longer than that. But at least 6 months seems to be a definite answer. And so by the time immunity runs out, we should already have that additional information. It should be significantly clearer what additional steps we need to take, if any. Maybe the vaccine is good and we're fine. But if there are additional steps, we'll be able to know much better then what we need to do. Based on recent studies, it looks like that the immunity from just getting COVID-19, it may last a longer time, but for most people, probably not anywhere near as long as with the vaccine. It's just not as reliable. It's more variable. It seems to depend a lot on how bad of COVID-19 you got. Basically how much of it you got into your system, which translates into typically more symptoms or worse symptoms if you got more of it, which typically translates into better immunity once you get past it, though that's not always the case because every body is a little bit different. So speaking of immunity, a new study has shown that those over 65 years of age that have gotten COVID-19 but not the vaccine, they have about a 50-50 chance of getting COVID-19 again. They don't have full immunity. If they get the vaccine, then of course that drops significantly. There's very little chance that they'll get it again, just because the vaccines are so effective. For those who are under 65, it's much lower of a chance to get it again, but it's still a 20% chance of getting it again if you don't have the vaccine. So either way, you want to get the vaccine. In more vaccine news, the CDC announced that about 1/6 of U.S. adults have now been fully vaccinated, meaning 2 doses of the Pfizer or Moderna vaccine or a single dose of the Johnson & Johnson. Additionally, now we've got 40 states that are on track to have the vaccine available for everybody age 16 and over by May 1st. So that's great. President Biden has also changed his goal. His previous goal was to have 100 million vaccines given out by his first 100 days in office. He's just over 50 days in office. I think by now it's around 60 or something. But he's already reached that goal, and so he changed it to be 200 million by the time he reaches his 100th day in office. We are on track to reach that goal, so that's really good news. Things are definitely looking up as far as the vaccines are concerned. Another thing is that AstraZeneca announced trial results from a trial in the U.S. itself. They announced those results early in the week, and after a bit of feedback, they announced some more updated results a couple days later. And so the latest results from AstraZeneca show that it has about 76% effectiveness at stopping symptoms completely, and 100% effectiveness, just like the other vaccines, at stopping the severe symptoms, the hospitalization, and the death. So it definitely looks like a really good vaccine. They also pointed out that in the trial, there were no instances or no increased risk of blood clots. So what Europe has been seeing, just like the agencies there have said, they're not seeing any reason why AstraZeneca would be causing these blood clots, and they're not seeing any increased risk from taking the AstraZeneca vaccine. The next step for AstraZeneca is to submit the results to the FDA, which will likely occur within the next week or two, and then the FDA will have to go through with the process of approving it. If everything goes as expected, we'll most likely have the AstraZeneca vaccine approved by around the middle of April. A new study has also shown that the Pfizer and Moderna vaccines are safe and effective for pregnant women. In fact, not only does it protect the women, but it also confers antibodies, or the antibodies are transferred to the baby. And so the infant also receives that protection. There's quite a bit of other news about COVID-19 this week. Much of it is just rehashing things that we've already gone over. So I'm not going to spend any more time on COVID-19. I do want to get to some other news this week. So first off, murder hornets are back in the news. Starting to warm up a bit, and so we're starting to see some of those nests. Scientists in British Columbia and Canada, and also in the northwestern United States, have seen some new nests. And so they're trying to eradicate them before they get a foothold in our area, just because if they don't, things could get bad. And we're not talking about, people being killed by these things. It does happen, but it's rare. And that's kind of why they're called murder hornets. But in reality, it's very rare for people to actually die from these things. The biggest problem with these murder hornets is that they can decimate honeybee colonies, just completely wipe them out. And since honeybees are so important for the environment, they're the most prolific pollinators we have. They go to all the fruit trees, all the plants, the grain, all of that. They go through and pollinate most of that. We have other pollinators, flies and other things can pollinate, but honeybees are the biggest ones. And so if those are gone, we're going to have a major issue. Our food supply will have problems. The plants take in a lot of carbon dioxide, and so that'll start to build up in the atmosphere. Lots of other things. So we definitely cannot lose those honeybees. And so that's why we're so trying so hard to get rid of those murder hornets before they go in and just decimate the bee population. A study released this week suggests that a popular food preservative, TBHQ, can harm the immune system. This is something that's very in a lot of popular foods, the processed foods specifically. Pop-Tarts, Cheez-Its, and over 1,000 other processed foods have this TBHQ either in the food itself or in the packaging where it can transfer to the food. So this is just another reason why we should avoid processed food as much as possible. The food itself isn't really healthy for you. It's got a lot of extra sugar, fat, and or sodium. And now, we learned that TBHQ, one of the preservatives, isn't that great for us either. So just try and avoid processed foods if at all possible. Eating disorders and depression are both on the rise in teens. Part of the reason for the depression, based on studies that have been done, is definitely because of the pandemic and the associated social distancing and loneliness and all that. The increase in eating disorders may be related to depression, since one can cause the other. But in addition to that, studies have shown that an overconsumption of social media also contributes to these eating disorders. Basically, what's happening is that teenagers that spend too much time on social media start comparing themselves with the pictures they see there. And of course, the pictures they see there are not accurate depictions. We've had the ability to compare ourselves to other people for a long time, but we've never really had it as much as we do now with so much social media going on. In the past, if it was a face-to-face thing, there's only so much you can hide face-to-face. But on social media, people will stage their photos or videos so that it shows them in the best light possible. They'll even fake things so that it shows something that they actually don't have or don't look like or anything like that. And so it's definitely recommended that while you don't have to necessarily eliminate social media from a teen's diet, you do need to at least moderate that social media. You should definitely not spend all day on social media. It's just not healthy. Finally, for today, I'd like to point everyone to a link down below in the video description. It's basically an article about 6 ways or 6 tips to help you detect fake science news. This is something that we've had a big problem with during the pandemic. Tons of fake news has been put out there, some on purpose, some on accident, just following the crowd type of things. But we really need to get rid of this issue because it causes all sorts of problems if we can't trust the news. So how do we figure out what's right and what's not, what's true and what's not? Well, the article down below, we don't have time to go over the entire article, so I recommend that you read it. I will touch on the main points, though. The 6 main tips are: 1, as much as possible, make sure the studies that are being referenced are peer-reviewed. It's become very common lately to put out a study without it being peer-reviewed first, and then the media picks up on that and puts it out as if it's full. It's a 100% accurate study. I've even mentioned a bunch of studies. I try to make sure that I mention that they're not peer-reviewed yet or it's preliminary, but I'm sure I've probably missed it a few times. So I apologize if I've done that. But the main thing is we need to make sure that we're double checking our sources to see if they're peer-reviewed. Second, we need to be aware of our own biases. Studies have shown that people like to find information that agrees with what they already believe. And so we need to be aware of that and be cautious. If we know that we lean a certain way, we need to be more skeptical of sources that present stuff in that way, and actually go to the original source or try and figure out, is there a bias in this? Third, correlation is not causation. Just because something seems related does not mean that it is. It may be, but it's not 100% sure that it is. Fourth, we need to check on the type of study that we're looking at and its size. Smaller studies tend to be not as accurate, or at least not as relatable to the general population. Also, the type of study matters. If it's a study where they didn't actually do an experiment, they just observed, then it's not going to be able to prove causation. This is one of those where it's just going to show correlation or association, which may or may not be accurate. Those kind of studies are still very good, just because they can help us to narrow things down. But the only thing that can show causation is an actual experiment where you separate the subjects into different groups. You have a control. You've got placebos if it happens to be a drug trial or something like that. Basically as much control as you can have over it, the better your study will be. So we just need to keep that in mind. Fifth, we need to keep in mind that scientific truth doesn't need to have two sides to it. Just because the media wants to spend the same amount of time on the Democrat as the Republican viewpoint on certain studies doesn't mean that that's an accurate way to depict it. Scientific truth is scientific truth, regardless of what anybody thinks about it. The Republicans could be right about it. The Democrats could be right about it. Both of them could be wrong about it. It doesn't matter. Basically, scientific truth is just that. It doesn't care what your opinion is about it. It just stands on its own merits based on the studies that have been done and the evidence found. Don't go into something thinking, oh, well, it's pushing it to this side of the political spectrum all the time, and so that means that it might not be unbiased. Well, maybe it just actually is that side of the political spectrum that's correct in that specific issue. No political party is correct on all the issues all the time. It just doesn't happen. There's always opinions. But sometimes one side is more correct than the other on certain issues. Science is the way to make those decisions correctly. And finally, number 6, be aware that some groups, whether in the media or elsewhere, they value entertainment more than accuracy. And so they'll have the shocking headlines or the biased take on a certain issue. We need to try and make sure that we are aware of that. We need to try and find sources of information that are not going for the shock value, but they're actually trying to present the information in a correct manner. That's what we try to do here at Plain English Public Health. We're not perfect, but we do hope that we are helping to educate everyone about the actual facts. So thank you for watching the Plain English Public Health Weekly Report for March 26th, 2021. As always, and as I've mentioned earlier, in this report, we do have links below the video that will describe more what we went over, and will also introduce you to some things we weren't able to touch. So please take a look at those links. I'm Richard Greenland, and you have a healthy weekend.